Right. This up. Alrighty. All right. Hello, everybody, and welcome to AiArthritis Community Chat. I am not Tiffany Westrich Robertson. Listen to me, Robertson. I am Kelly Conway. You know, it's funny. All week I heard people introduced her, and they kept saying Robertson. So I was trying not to do that because when you say Westrich Robertson, and I'm a speech therapist. I am not Tiffany Westrich Robertson. I am Kelly Conway, one of the co-founders of AiArthritis. I'm joined here tonight by Lindsey Fiscara, who is one of our employees. Lindsey, do you want to introduce yourself?
Yeah, my name is Lindsey. I'm the public policy manager for AiArthritis, and I've been with the organization, what, now 2 months? I'm a baby. I'm brand new.
And we're still happy. I'm the OG. I've been here since the beginning, and it's great to be here. And we have Effie. Effie, will you please introduce yourself?
Yeah, hi, I'm Effie Koliopoulos, and I'm one of the patient advocates that works alongside AiArthritis and their mission.
Excellent, excellent. So as you can see tonight, we have a co-founder, we have a staff member, and we have someone who volunteers along with our organization. So we have a variety of people who are here tonight to chat. I'll start off by saying, why do we have these chats? Well, it's to be transparent with our community, to show you that we are indeed patients, patient advocates. We are people who are here in this community to make a change for the better. AiArthritis's mission statement is that we are all leaders in advancing education, advocacy, and research for those impacted by autoimmune and autoinflammatory arthritis diseases. And we do that through peer-led guidance, collaboration, and resources that are driven by patient-identified issues and are solved with patient-infused solutions. So in saying that, we're excited to talk about a new project that we have coming up called The Good, the Bad, and the Ugly, which is a soon-to-be ebook, which will start talking about things that happened for patients that are basically good and bad and ugly. I did hear one person say she feels that this is almost going to be like a Dear Abby kind of chat where a patient says something and somebody comes back and says, oh, well, here's a good solution. So the main thing that we're hearing from a lot of people are doctors just aren't listening to me. So as a community and as an organization, everything we take on is based on these patient identified issues. And this is a big one because I'm sure all of us who are here can relate to having that time, that feeling when you're in a doctor's office and they're just not listening. But this is also a concern for rheumatologists. So we do have, in addition to having patient stories, we are also going to have rheumatologists who will then add not only to their good, the bad, and the ugly situations that they have in their practice, but also maybe problem solve how things can get better. So the whole idea is that we're going to collect stories and put them into chaptered themes as a way to improve shared decision-making through better communications. We're going to tell a story and then experts will give their perspective on it. We can improve communication as a tool to improve our overall patient experience. So that's basically what we're here to talk about tonight. It's a very exciting project. I'm excited to be a part of it. And so we thought tonight, I know the last community chat, everybody really talked about the bad. So I thought we'll start talking about the good. So Effie or Lindsey, would either one of you like to share a good story?
I can share a good story.
Would love to hear it.
So my son has chronic recurrent multifocal osteomyelitis, which is a rare AiArthritis. It's an autoinflammatory disease, not an autoimmune disease. And we are on our 4th rheumatologist, of course, because that's how it goes. But the first time we met him on Zoom. He spent a full hour with us, it was crazy to me, a whole hour on the phone. And at one point he said to me, Mom, what do you think it is? And I almost fell off my chair because nobody had ever asked me what I thought or even thought that I might have an inkling of what it was. And I said, well, I have psoriatic arthritis. So what are the odds that he doesn't have an autoimmune or autoinflammatory arthritis disease? I mean, what are the odds? And he was like, no, you're totally right. It's something, and we're going to figure it out. Eventually we're going to figure it out. We're not going to stop till we figure it out. And that was the best thing. Like once he said that, then the weight was off my shoulders, because I knew that he wasn't just going to say, oh, his labs are fine, he doesn't have anything, or I knew that he had us. And so for him just to say that, just to say, we got you, we're going to figure it out, and we're just going to keep going until we figure it out, no matter what it is, whether it's something I can treat or not, we'll help you figure out what it is.
Right.
So that was a good story for me.
I think it's also really good to hear that sometimes the doctors don't know, but they're willing to take the time to figure it out. And I think that's with any science. You know, you might not know at first, because again, I think what we've all figured is no two patients are alike. We might have very similar symptoms and similar experiences and similar things happening in our bodies, but you know, we can have the same diagnosis and one person can still be running marathons and the other person is using a cane to walk around. So it can be very different for everybody. Effie, do you have any stories you'd like to share?
Yeah, I mean, for me, I have like more bad stories than good, but the positive ones have been very positive. For instance, before my knee replacement, I had not really the best experiences, and I felt kind of like it was like a twilight zone in a way, where I was like, I don't know what's happening. But the doctor that kind of, you know, saved my life, I would say, like in regards to like helping me walk again, helping me to get a referral to an orthopedic surgeon, he was a 6-month wait. So I know Carrie Wong had written an article about like her feeling that it was worth the wait, even for her doctor, she waited 4 months for. But when I first saw him, the first thing he said, he was just like, I'm going to send you to an orthopedic surgeon and then come back and see me. So he was more of a doctor that took action and was very thorough, and it matched my energy. And so I think that's really important when you are looking for a doctor, to see if they match your personality, because he did everything under the sun, you know, in regards to blood work. I didn't really have to ask him what to do, you know, and even if I did, he would do it too. So I just feel like that was a really positive turnaround, because after that, I did need a knee replacement, and he just gave such good advice and was a great mentor as well in regards to my health. So even though he retired and I went to someone else now, I do feel that set me up for, you know, just better health, you know, because the first thing he said to me is like, I don't let my patients get this way. And before that, I had seen some of the best rheumatologists in my city, but, you know, unfortunately, when I would go to the offices over there, everyone was using mobility aids. You didn't see anyone without them. So that made me also question, what are those rheumatologists doing? Why are they, you know, having that situation? But at this rheumatologist office, you didn't see anyone. Like everyone was like thriving in a way too. So it was different. It was interesting. And that just begs the question, like, is it because of, you know, disparities and like people not having access, or is it because doctors are just different and they don't take the actionable steps, you know, for patients? So
okay, this is not Tiffany Westrich Robertson either. This is Penny Rue, who believes she is a cat and sits on top of the furniture. Anyway, you know, that's really interesting. Now, I also had a rheumatologist who retired, and when I first met her, I referred to her as my miracle, because she finally listened to me. And then she ended up not retiring. She sold her practice to take over the rheumatology practice at the VA in Philadelphia. And I didn't fit the criteria of the type of patients she was keeping on with her. So I had to find a new doctor, and they gave me a name of who the practice was sold to. And at the time, selling your practice, like, it didn't make sense to me. And I was like, well, this doctor is at this hospital. This other hospital is closer to me. I think I'm going to try and find a doctor at this hospital. So that's what I did. And I saw 3 doctors. One just looked at my blood work and canceled my appointment. So there was no reason to see me. The other one basically told me there was nothing wrong with me and wanted me to come off of all the medication that my previous rheumatologist had me on, which took me from walking with braces and canes to walking without braces and canes. And then finally I got in to see his partner, which is who I wanted. She was on maternity, so I couldn't see her right away. And she was lovely. And I said, well, you know, your partner wants me to go off all my medicine. And she's like, well, you could. And I was like, oh, she wouldn't speak against him, which I wasn't asking her to, but also I need somebody to treat me. So finally, after, as I said, kissing some frogs in the rheumatology field, I decided to go to the doctor that my brilliant rheumatologist sold her practice to. And again, my first appointment was over an hour. And I think it's because back at that time, she was starting a practice. And I think a lot of people probably didn't go to her right away. She sat with me for an hour, and I remember walking out and just crying because she listened to me. And I said to her, I said, you know, these other doctors were telling me something was wrong with me. And she lifted up my file, which was thick. And she said, this is in itself is saying there is something wrong. She's like, you wouldn't have a file this thick if there was nothing wrong with you. So being heard is a really good thing. And it's, you know, it is empowering because she'll, you know, when you have a doctor who will listen to you and actually say, you know, I'm not sure, but let's figure it out. So that's good. I think communication is something that all of us are saying is good. Is there anything else you can identify as good? Now,
Yeah,
you felt like your doctor saved your life. Is that anything you wanted to?
I wanted to add a little bit, like the current rheumatologist I have now, she's been in practice for over 30 years. She was the honoree for the Arthritis Foundation here in Illinois at one point, and worked with them. And then, you know, even till this day, she spends about like 45 minutes with me. And she doesn't have to because she's like, you know, more of like a veteran rheumatologist, but she spends like 45 minutes to an hour with each patient sometimes. And she listens, she looks at all the blood work. Going back to what I was saying, you know, obviously people who use mobility aids thrive too. I mean, I was one of those people, but I'm just trying to say back then, it was like apples and oranges where you go to an office and it's like, that's all you see versus other offices where people are not using those things at all. It makes you question kind of what is going on in certain offices and what doctors are doing for patients versus others, you know. And I know like everyone is impacted by the disease differently, but that was just like something you would have to see in person to understand what I'm saying. It just didn't sit well with me or my parents at the time. It just like, and I was also not really getting the proper care, like looking back, you know. So now it's like I am getting tailored medicine with these doctors that I'm seeing. I'm not just throwing a biologic or this and that and then like it not working fully. I'm having them look at my blood work. I'm having them do precision medicine, which should have been done in the beginning, but it wasn't. So, you know, we can think about the what ifs and the should have, could have, would have, but that is something that is important. And those are what the doctors I see now do. So,
right. Now,
the other thing I wanted to mention was that it also is nice. My rheumatologist, the last time I saw him, he said, you got a haircut. And I hadn't seen him in months. And just that tiny little thing that he remembered made me feel more like a person and less like a number to him. And he'll say, how are your kids? Or how's your new job? Or whatever it is. And I know some doctors have thousands of patients and they can't do that. But even just a tiny little thing, how was your weekend? Before they dive right in to your labs or whatever, just a tiny little thing makes you feel more like a person and less like a patient. Because I mean, I feel like a patient all the time.
Yeah.
And it's nice to feel something other than that when you go to your
like a person. Yeah. With interests and hobbies and careers.
Right. Exactly.
I mean, that's what my rheumatologist does now. We talk about things, you know, so
yeah.
Nice.
Even if he can't remember something specific about me, just to say, did you do anything good over the weekend? How was your holiday? Like anything that they can think of that makes it more personal.
Okay. I see Patrice just typed in here, like most of you, I had multiple roomies. I'm on my fourth one now. Are you happy with your current rheumatologist? We can let her type that in. And I will also say what I think is interesting too. I was very nervous about telling my rheumatologist about what I did. And I always call it my other life. You know, she's always asking me about my work with kids because I get sick all the time. And, now she'll say, well, I normally wouldn't talk about this with patients, but she'll talk to me about things with billing, and she'll talk not specific to, you know, me or any other patients, but more, you know, this is what's going on. What are you doing? What is your organization doing? How are you advocating? Or, oh, you're going to Capitol Hill. Please talk about this. So she's been really wonderful with that. But I also wonder too, because I think we all tend to hear the bad stories. And it makes me wonder, because again, I think there's an arc to all of our diseases, and we have ebbs and flows of good times and bad times. And I really think when we're, especially, you know, as an adult, I started with symptoms at age 14. I didn't get a diagnosis until 32, I believe, maybe 33. I can't remember. It's fuzzy in my mind what year I was diagnosed. I think it was 30. I think I was 32. So that's a long chunk of time. And I would have symptoms and I wouldn't have symptoms. At 32 or at 31, it hit me so hard. And it was horrible. I just switched jobs, like all this stuff. So I wonder if in the beginning, when I had all these really bad experiences, could it have been amplified because I was in so much pain? I was so scared. And I felt like an island. I felt like I had nobody who understood. You know, and I used to pray, oh, maybe it would be better to get lupus instead of rheumatoid arthritis, because I got diagnosed with Sjogren's and had zero symptoms of Sjogren's other than joint pain. And I was like, well, my neighbor and my aunt had rheumatoid arthritis and I saw what it did to them and it scared me. But then I had friends in college who had lupus and that scared me. So I think those amplification can actually make those bad situations that maybe if I went through the same thing now as having experience and having a little bit more control over the decision-making process, maybe it wouldn't have been as bad. But I think it is good to focus on the good and to see, you know, sometimes it's hard. I've said before, and I've written about it a lot. When I first got the diagnosis, I thought it was the end of the world. And I eventually learned it was a different way of living in the world. And it's still good. Does it have bad moments? Yes, but everything does. And somebody said to me, do you wish it would go away? I'm like, yes and no, because yes, I would love to not live like this, but no, because it's brought so much into my life in terms of friendships and this foundation and the fact that I can do advocacy work. And I found something that I'm very passionate about. Now, does anybody want to share maybe an ugly, something that's beyond bad to an ugly?
Just trying to think. My son has been told
the friendships and the networks, she agrees, are the good.
I can share an ugly. So I started having symptoms at 18, probably way earlier than that, maybe from 5th grade, who knows. But when I went to Mayo Clinic, so I had been diagnosed here in Illinois at the Illinois Bone and Joint Institute. And so then, you know, obviously that was in 2004. So I went for a second opinion, but the second opinion was a 6-month wait at Mayo Clinic. And I remember seeing the head of rheumatology there, and it was him and another woman. And he told me I probably won't live till 60, knock on wood. And so like, that was when I was 18, but I didn't really have any visible damage that you could see. I was like the epitome of like the invisible illness person. And I mean, yes, I did have some mild damage in my wrists, some mild damage in my knuckles, but it wasn't anything like, you know, like I have now, for instance. So yeah, that was a little shocking. And I don't think it was called for, but you know, fast forward some years, I was in like a Facebook group and some guy had mentioned his experience at Mayo Clinic around the same time I went. And I'll share his ugly experience because he posted it publicly, but I don't remember his name, but he said that he went around that time, talked to the head of the rheumatology and asked him about alternative functional medicine, which we are allowed to do. And he was told to get out of the office. So that was just like very abusive. Yeah.
Lindsey, I posted the out till on that one. Okay.
Yeah. So that's like, it's very abusive to do that to patients. And you can't tell someone their outcome. You're not God, no offense. So like, I think back then I was just really shocked and I was 18. I didn't have the experience. If I was able to teleport back into my body now at that age, I probably would have told him off. But you know, at that time I just sat silent, and so did the family members that were with me. So that was traumatizing. And so that doesn't help, you know, patients first and foremost, start medicine, start treatment and all that good stuff. So
now, Lindsey, you were going to share a story about your son.
My son we were told by the, I don't know, first, second, third, I don't remember, that because he didn't have any joint damage yet, they couldn't diagnose him. they're like, we really like to see some joint damage first. And I was like, what? Isn't the point to stop it before it gets to joint damage? And so I literally said that in the office, and then we left and found somebody else. But I was like, you cannot tell, these are scared parents. I mean, my own health is one thing, but when it's your kid, it's a whole different thing. And even though I had the experience I had, I was still just a scared parent in that moment. And for him to say, we really like to see some joint damage first, come back in a year and maybe there'll be some joint damage.
And that's a false thing too, to
right?
say, because actually what I found out years later with the good rheumatologist is that the best way to find out if there is joint damage is through an ultrasound. X-rays don't pick up damage until it is actually a problem, mild to moderate, and you don't want it to get there. So my rheumatologist that retired, who was really good, he would always give cortisone injections with an ultrasound, guided ultrasound, to go into the direct spot. And there have been a lot of people who've been diagnosed with RA using an ultrasound. X-rays are just X-rays. And this is something I've heard from an ultrasound tech who has 40 years experience, like it doesn't come up right away, and so you have to advocate for yourself and be like, no, I don't want to wait for my child to have X, Y, and Z. Like, what's wrong with you? Would you tell this to your child? I don't think they would do this to their kids.
Yeah.
They would run and do what they need to do as medical professionals. And going back to Kelly's point, I think like when you have a medical background, like a nurse or, anything else, like I had spoken to one person who is a nurse, she was able to order her own blood work. Like you have that background to advocate for yourself or just know what to do, but a lot of people don't. So I think that kind of goes back to like, would you have a different like thought process or act differently? I think that also plays a role too, because I know a lot of medical professionals who've been diagnosed, they just tell the doctor, well, tell me what to do. They don't ask, like, you know what I mean? They don't have that fear because they already know about all the medical stuff.
And I think also a lot of people like to keep things very quiet. Like my mom gets very upset with me that I share so much. And I said to her, like, I share so much because when I was diagnosed, nobody knew. I needed somebody to understand. So that's how I found Tiffany, and that I bought a bracelet off of Tiffany. That's how I met Tiffany years ago, because she was doing awareness bracelets. So some people just don't say anything. And I remember my best friend's son, who I refer to as my nephew, he was diagnosed with ankylosing spondylitis. And I remember a year before the diagnosis, they said he hurt himself sliding into a base playing baseball, and his hip was hurting him. And it hurt him off and on for a while. And he was having a hard time running track. He gave up baseball. And then, they kept going. They kept saying it's tendonitis. They were icing it. They were doing little stuff. And finally, one day, my best friend just said, my kid can't get out of bed. My husband had to pick him up. My son can't get out of bed. So they finally sent him for an X-ray, and I think possibly an MRI. Don't recall, but I know definitely an X-ray. And they got a phone call, and suddenly the people in the office were really nice to them, which they hadn't been. They were kind of like sick of hearing from them. And they basically said, you need to get to Children's Hospital to get a rheumatologist. And oh boy, are you so lucky that we live in this area, because we have a lot of pediatric rheumatologists at this hospital. So if they would have just, mentioned it to me, I probably would have pushed them to like go. But some people don't want to talk about it, and they do spiral through things alone.
Yeah.
And it does get really scary. My ugly moment, and it was, again, right in the beginning when I had just switched jobs. I was going to graduate school, working on a master's degree. I was working full time, going to school at night. And suddenly I could barely use my hands. I could barely walk. I remember walking out of supermarkets because I couldn't lift my arm up to get the tampons off of the shelf. I couldn't lift my arm, and I was too embarrassed to ask anybody for help. And I left an entire cart of groceries, and I walked out sobbing. So I live in the Philadelphia area, and I work in a county outside of Philadelphia, and I had to drive to LaSalle University, which is where I was going to school at the time. And I could only drive with my thumbs. So turning the steering wheel, I had to do it all from the bottom. It was in so much pain. And I was seeing a rheumatologist, and they had said, oh, you'll start feeling better, within a few weeks taking this drug. And I got to campus, and I remember it was raining, and I couldn't get a close parking spot. So I was in the upper parking lot, and I was crying because I knew how painful it was going to be for me to walk from my car to the building. And then the elevator was 50 miles away from the front entrance. And so I was just so low. And I called, and the physician's assistant got on the phone with me, and her exact words to me were, it took you this long to make yourself, it took you a long time to make yourself this sick. It's going to take you a long time to get better. I did this to myself. What do you mean I did this to myself? And I like flipped in the car, like crying, like, what do you mean I did this to myself? And I felt such guilt. And she's like, well, you know, you work a lot, you're going to school, it's too much for your system. You should really give one of them up. And I'm like, I have to give up my dream? Like, not only am I sick, but now you're telling me I have to give up my dreams as well and my career. And so it was so, in that moment, that was the one moment I remember she's like, you need to call somebody, you need to get yourself help. And I said, I am going to get myself help, and I'm going to start by finding a new rheumatology practice. I'm up on her. Let me see.
I wish everybody would say something when they feel it, because we all think it, but we don't always say it.
Yeah, I did. I don't know where I got it from in that moment.
The theory, maybe they would get it. That
you got that inner power.
Doing a good job.
Yeah, that was like a moment that I'll never forget. Like years later, when I thought about it, I'm like, normally I think of stuff later, and I should have said this.
Yeah.
But I didn't. Let me see here. How often do you think us patients are told we did something to our bodies that caused our arthritis disease? Well, I was. So, and I don't think I'm that rare with it. Anybody else? Were you guys ever? You were?
Mm-hmm.
How can you cause psoriasis?
Right.
I can't say the word.
Right.
Psoriasis. How could you cause it?
Right.
How can I cause my joints to swell?
Right. Just, you know, they said, well, you probably just were doing too much, or, you know, you're stressed out. Okay, whatever you say, but
so
I'm pretty sure that's not where it came from, but okay.
Right. And I do think, I mean, the fact that when we started out, we were a movement. We were called the Buckle Me Up movement. It had to do with those bracelets I bought.
Mm-hmm.
Because we had to ask somebody to help us put the bracelets on us because our hands weren't working. That was the whole idea behind the bracelet. So we came to the Buckle Me Up movement, and then we transitioned into IFAA when we became a foundation. And that's when I went from being a volunteer to a co-founder. And then we moved into the nonprofit realm. So we've really grown over the years. But the thing that has happened, and I think Patrice agreed with me when I mentioned before, there is a community that forms when you're in this kind of situation. There's people that I've never met, but when I see them, the first thing I do is hug them because I feel like I've known them. And they might have made a post, you know, late at night one night, and I would see it 2 days later and be like, oh my gosh, they get it, or they understand, or that's somebody I know I can talk to if I really, you know, have a question. But I think when you find good community members, now there's also a lot of frogs in the community members, because again, a lot of people aren't feeling well. And I think they're very reactive at times. There was a blogger years ago, she has since passed away, but she ripped apart another blogger because she said, she's just not relatable. Her disease seems mild. I was like, well, it could be mild, but again, don't negate what she's going through just because it's different than yours. Because again, whenever anybody's experiencing pain, it's severe pain to you. It is a big problem to you, just as it's you know, I don't think this is a competition having this. And that's why I think it's so important when Effie reached out and said, hey, would you like to submit a story for this book I'm doing? I was like, absolutely, I would love to. And somebody said to me later, well, is that your organization? I'm like, no, but we're all a community. Of course I'm going to support that. So why don't we lead into, Effie, why don't you tell us about your book that's coming out that I'm proudly a part of, and I can't wait to get it.
Yeah, so I received a grant called the Healthy Voices Impact Fund last October, and it's a grant given to several advocates and activists who are trying to make change within their communities with an idea. So my idea was to put together a book called Keeping It Real with Arthritis, and we have come up with the subtitle Stories from Around the World, because I wanted to collect stories from outside of the United States as well, because throughout my past few years in online advocacy. And even when I used to work for the Arthritis Foundation in college back in 2009, I realized that there was people, you know, outside of where I am who are struggling too, you know, Australia, England, like it's all over, you know, arthritis doesn't really care what your age is, where you live, your background, anything, as we all know. And so eventually evolved into me organizing the book into themes by like having like how arthritis has impacted you. So, I mean, personally, arthritis has impacted my life in all levels, physically, mentally, and emotionally, financially, socially, relationships, finances, career, and spirituality and faith. Like those are all the themes that are in the book. So I decided to split them up, but I also wanted to give a voice to some of the supporters, which I like to call people who help us, whether that's like your parent, your caretaker, medical professionals. So in the book, yeah, the theme chapter for arthritis supporters is one of the smallest, but that's okay because each story is kind of like the people who submitted, whether it's a rheumatologist, occupational therapist, parent, it speaks volumes in that chapter, and it's the first one in the book. So yeah, that's basically kind of what the whole gist is with that, and kind of like what you guys are sharing. A lot of people, you know, shared pieces that relate to the good, the bad, and everything in between. I don't think we really left any stone unturned. And and if not, and if we did, then I'm sure people will add to the conversation in another way too. So that's kind of what that's all about. And we have pre-orders going on now, and it will be launching December 6th. So yeah.
Right. And we'll be linking, sharing the link for some pre-orders.
Sure.
I think. Yeah. We'll probably do that separately because I think our one guest, I'm pretty sure, has access. Patrice says, congrats, Effie, and thank you so much for including my story.
Yes, Patrice is one of the other contributing authors. Yeah.
It's exciting. And again, this is still not Tiffany Westrich Robertson, but they all show up when I speak. So yeah, I'm very excited to see that. And I think also with our book, The Good, the Bad, and the Ugly, I think the patient voice is something that I have been very passionate about. And I think I can imagine for you too, Lindsey, being not just only an advocate for yourself, but an advocate for your son. I mean, advocacy takes on so many different hats for so many different people. But I think we covered a lot with this. Can anybody have anything else you want to add, or?
No, I think the patient voice is important, but so is the clinical perspective as well, which, you know, the ebook that you guys are putting in together will include, and so is the Keeping It Real with Arthritis. We have both perspectives, which is important to hear because that's how we can make progress.
Yeah, exactly. And I remember doing the very first roomie rounds it was the very first roomie rounds with Tiffany, Dr. Al Kim, and myself. And Al is Tiffany's rheumatologist. And we were talking, and in my mind, now I'm a therapist, I'm a speech language pathologist. I treat patients, I treat students. So I know when they come in, I know what I have to cover. Didn't dawn on me as a patient that that's what the doctor had to do. In my mind, the doctor is going to listen to what I say and then make a decision. Meanwhile, the doctor had all this stuff based on their previous notes, based on my blood work, what they were going to move into. So sometimes I realized, well, maybe sometimes that's why, you know, some days go faster than others. Other times they really want to sit and listen. So I think hearing the good, the bad, and the ugly from the rheumatologist perspective is also going to be pretty eye-opening for a lot of patients, because I think that's something we don't think about. I didn't think about it, and I do something not similar to medicine, but I treat people. So you would think I would have known that, but it's interesting. Let me see. Do we have anything else? Anything else you think we should cover? Community chat?
I think we did a good job.
I think we did a good
job. Needed,
yeah.
I think
considering that none of us, is a professional at this, I think we did a pretty good job without the rest of the staff.
I agree.
Whoa, yeah.
I know.
Maybe they'll ask us back.
Maybe. I've taken a break from the podcasting, so I would like to get back into that too. And I know, Effie, you're doing a roomie rounds coming up.
Yes, this Friday we are recording one of the roomie rounds. Yeah.
It's exciting. Very exciting. All right. Well, ladies, it was an absolute pleasure. seeing you. For just a split second, I panicked thinking I forgot to turn the record back on, but I did. I did. I almost had a heart attack there. And Patrice, thank you for joining us. And we'll see you next December 15th for community chat.
Indeed.
All right. Thanks, ladies.
Thank you.
Bye.